Sometimes advocacy is about life and death. And over the past few months, working with other groups, we've worked on healthcare equity. And as many of you know about Operation House Call, but we've gone beyond that, and as well as reached out to hospitals. And the crisis standards of care effort organized with the Center of Public Representation and others had great results with the administration and corresponding support from Secretary Sutters, so that people with disabilities were more protected than they were at the beginning of the process. We worried that people would be denied life-saving treatment. In Texas, Michael Hickson, unfortunately, wasn't so fortunate. And he passed away during this COVID pandemic. The hospital decided to stop treatment. The sister, having a tape on, and in Texas you can do that, you don't need dual agreement, asked the doctor attending, "What do you mean?" By the way, the sister is a doctor, but from Washington, D.C. "What do you mean? Because he's paralyzed with a brain injury, he doesn't have a quality of life?" That was the basis on which they were stopping the treatment. And the doctor, quote unquote, said, "Correct." And then the hospital declined an interview on behalf of the doctor after that. This is on tape, so it did happen. It's something we worry about. It's happened in other situations across the country. And that's why advocating for equity in all sectors of society, whether it's medical, educational, first responders, police, is so important. And in this case, Michael Hickson was an African-American man, and he faced the dual dilemma of both being African-American, right? Black Lives Matter, and having a disability. We need to work together to advance advocacy, to advance the recognition of people with disabilities. And I know together we can do it. And the ARC stands with you in our community. Let's keep advancing the fight. Take care.